Hello, everyone, and welcome to the HIAC One-on-One Podcast, brought to you by the Health Informatics and Analytics Club at the University of North Florida. I'm Agrani Sinha, your host for today's conversation. In this series, we sit down with thought leaders and professionals shaping the future of health informatics. One guest, one story, one deep dive at a time. Today, we are honored to have with us Dr. Yuqi Wu, whose work focuses on advancing the role of artificial intelligence and data driven approaches in healthcare. Dr. Wu, thank you so much for joining us today. We are really excited to have you here.
Hi, Agrani. How are you? Thank you so much for having me here today.
I'm good. Thank you so much for joining us today. So, before we dive in, let's start with a quick icebreaker.
Sure.
If AI could instantly solve one major problem in healthcare tomorrow, what would you want it to be and why?
Um, Maybe I would say to reduce the administrative burden and to reduce the documentation workload for the healthcare professionals.
Okay, that's great. So, Dr. Wu, you have been deeply involved in advancing AI in healthcare. What originally inspired you to explore AI and data driven research in this field?
Okay, that's a very great question. So, just a little bit about myself. My name is Yuqi Wu, and now I am the assistant professor of health informatics in the Department of Health Administration at UNF. So, to answer a question, my background actually started in public health and health services research. Just for your information, I got my PhD in health services policy and management. Um, but I did have postdoctoral training in the area of AI in healthcare. Um, so just during my doctoral training, I was working with large healthcare data sets, starting things like cancer screening, chronic disease outcomes, and health disparities. So at that time, most of the analyses were done using traditional statistical methods like logistic regression. So those methods work very well when the data set is relatively small and the number of variables is limited. But when I was working on my dissertation, I had data sets with more than 20,000 data points and over 100 variables. So then I started to feel the limitations of traditional methods, right? Especially in the, feature selection period, and also to explore the hidden associations among the variables, and also handling the complex relationships between the variables, right? So then in my dissertation, I actually had two chapters addressing the exact same research problem. So one chapter was I used traditional statistic methods, and then the other chapter I used machine learning methods to compare the results, and also I did the risk prediction and the feature importance ranking using ML. So that experience really opened my eyes to how machine learning could bring new possibilities to the healthcare research. And later on, during my postdoctoral training at Mayo Clinic in the Department of AI and Informatics, I started working more with the EHR data, especially unstructured clinical tests, those lab images, uh, you know, even patient messages from the portal. So that's when I moved into, natural language processing NLP and large language models, LLMs. So my research journey really moved from statistics to ML to NLP to LLMs and now to the AI systems that support clinical decision making. And at the end of the day, my motivation has always been the same. That is using data and technology to solve the real healthcare problems and to, just improve health outcomes.
That's fascinating. It's always interesting to see how personal journeys shape impactful research. In your experience, how are AI and machine learning currently transforming clinical decision making or healthcare operations?
Sure, yeah, that's a awesome question too. So, well, in practice, AI is already transforming healthcare in many, many ways, especially in areas that involve large, like I said, large amounts of data, or those repetitive manual work, right? One example from my work at Mayo Clinic you know, was about thyroid cancer pathology reports. Traditionally, clinicians, researchers who have to, manually review and summarize the pathology reports, which takes a huge amount of time and professional labor. Now we developed an NLP pipeline that could automatically extract the key tumor information from those unstructured pathology reports and then classify the tumors into different cancer risk levels. Another project involved building a large language model question answering system that could read biopsy reports and also predict tumor classification based on the clinical guidelines. So, beyond the specific projects I've worked on, the use cases that excite me the most are actually related to where AI is heading right now. I think we're entering a new stage of AI development, especially with AI agents and multi-agent systems.
Yeah.
Uh, Instead of building like one model to do one task, we're now moving forward to building like AI systems where
Generative
multiple
AI.
agents,
Yeah.
right, work together to complete, complex tasks. I don't know how much you know about them. Um, Maybe if we want an example, I can give you guys an example here. For
Sure.
example, imagine like a hospital where different AI agents work together like a team. You know, one agent could monitor patient data and identifies the high-risk patients. Another agent looks at the hospital bed availabilities and staffing, and another agent reviews like clinical guidelines and suggests treatment recommendations, while another agent helps with documentation and summarizing patient notes. So that's a
That's
an
really great. Yeah.
yeah.
Yeah, that's great, especially as we see AI becoming more integrated into real world healthcare systems. So, AI in healthcare raises important questions about bias, privacy, and human oversight. How do you approach balancing innovation with ethical responsibility?
Sure, sure. Yeah. That's a great question too. Ethics is extremely important in
Yeah,
healthcare AI, because we're not just working with data. It's not normal data. We're working with people's confidential health information and sometimes their lives. So data privacy, security, and responsible use of AI are always very important in our research. In my research, for example, most of the clinical data we use come from the electronic health record systems like Epic. So before we receive the data, they're already de-identified by analysts. So we usually do not have access to any personal identifiers. That is a very important step to protect patient privacy. And for model development and data analysis, We're also very careful about where and how we run our models. For example, we usually use open source standalone models and run everything in a local secure environment instead of uploading data to external platforms or online AI tools such as ChatGPT. We never do it. So this helps make sure that sensitive healthcare data always stay within a secure environment. Well, then beyond data privacy and security, another important ethical aspect is that we do not use AI results blindly. So just because a model gives a prediction or a result doesn't mean it is always correct. So in our research, we not only look at the model results, but also try to trace back the evidence, review the important features, and verify whether the results make clinical sense. I always tell my students that AI should assist decision making, not replace human judgment, especially in the healthcare area. Humans must always stay in the loop to interpret results, to validate findings, and to, make the final decisions. Um, yeah,
That's such an important point. Ethical AI is something every future professional needs to understand deeply. So, for students and young professionals who want to work with AI in healthcare, what skills should they focus on developing today?
sure. Yes. I think the most important things for student to do now is to, I would say, just stay open-minded and be willing to continuously learn new tools and methods because AI is evolving very fast. In this field, what you learn today may change very quickly. So you have to be comfortable with constantly learning, reading new papers, trying to try new tools and sometimes stepping out of your comfort zone and iterating how you do research or solve problems. Another important thing is that when we use AI, as I said, it is not enough to just know how to run a model. You also need to understand the data, the clinical context, validate the results, and oversee the entire process. In fact, the more AI can do, the more it actually relies on health informatics professionals to supervise the process, to interpret results, and to justify the decisions. So AI does not reduce the need for expertise. It actually increases the need for people who understand both data and healthcare context. Um, I would also say students should not focus only on coding or algorithms. Those are important, but in health informatics, understanding healthcare data and clinical context is extremely important and is actually the core of this discipline. For example, when dealing with clinical data, sometimes they are missing values for certain like diagnosis or lab results. Someone from a pure computer science background might just treat those missing values as errors or outliers and even remove them or impute them incorrectly. But in healthcare data, missing values sometimes have clinical meanings, such as a test not being ordered because simply the physician did not think it's necessary. So, without understanding the clinical context, the data could be pre-processed in a very incorrect way. So again, I usually tell students because health informatics professionals often work between clinicians, administrators, and technical teams, communication and translating between different groups is very important. I would say health informatics is really a bridge between them, and people who can understand both sides and connect them will have a lot of opportunities in this field. Thank
That's
you.
really valuable advice, especially for students trying to navigate this evolving space. So, looking ahead, where do you see the biggest opportunities for AI to make a meaningful impact on patient care or health systems in the next 5 years?
Oh, I love this question. So I think again, AI is evolving very fast. So it will impact healthcare at multiple levels. So first, I would say at the patient level, AI agents could become such as personal health assistants, that can help with preventative care, personalized health recommendations, medication reminders, and even monitoring health conditions. So instead of only seeing a doctor when they're sick, patients could have AI tools that help them manage their health on a daily basis and even focus more on, this prevention and long-term healthcare management sides. That is for patients. So then for sure, second at the provider and hospital level, right? As we said, we may see what I would call the multi-agent digital hospital system. So this is a very trending concept now. And in this type of system, different AI agents help with different tasks. As I just gave the example, you know, they can help with like scheduling, documentation, even patient triage, uh, you know, clinical decision support, and even hospital operations. Um, so third, besides those, for the stakeholders like pharmaceutical companies and insurance companies, AI could help reduce research and development costs, and to improve clinical trial design, and reduce administrative workload. So AI will not only impact patient care, but also research, operation, and healthcare financing. Um, but I also like to say that anything we predict about AI today could become outdated very quickly because technology is evolving so fast. For example, nowadays, with tools like Claude and vibe coding tools, we no longer need to spend like hours setting up coding environments or debugging simple programs. We can describe what we want, and AI can help generate and refine the code. So many people are even starting to use like AI agents like OpenClaw to automate daily tasks and workflows. So the speed of AI innovation is incredible, and healthcare will definitely continue to change very quickly in the next 5 to 10 years.
That's exciting. It really shows how much potential lies ahead in this field. So, let's wrap up with a quick rapid fire round. Are you ready?
Yes,
Okay. So, one word to describe your teaching philosophy.
I would say practical.
Awesome. Your favorite AI application.
Well, again, it changes, but for now, Cloud Code,
Okay. Coffee or tea?
always T.
Same here. One resource every informatics student should explore.
For me, it's AMIA conference.
Okay. One healthcare problem AI should solve immediately.
I think that we've covered that. That is the administrative burden and documentation workload.
Great. So, Dr. Wu, thank you so much for sharing your insights, experiences, and vision with us today. This has been an incredibly valuable conversation. Before we close, Is there any final message you would like to share with students who are aspiring to work in AI in healthcare?
Sure. Um, if there's one thing I hope students remember that is, technology itself is not the goal. The goal is to solve, again, real problems and help people. And data are just tools, but healthcare is about people and improving life quality.
That's truly inspiring and a great note to end on. Thank you once again for taking the time to join us. It's been an absolute pleasure having you with us. Conversations like this are exactly why platforms like HIAC exist to bring together ideas, experiences, and inspiration for the next generation. To our listeners, thank you for tuning in to the HIAC One-on-One Podcast. We did love to hear your thoughts. What inspired you most from today's conversation? Feel free to share your takeaways with us through HIAC's channels. Until next time, I'm Agrani Sinha, and we look forward to having you join us again soon.
Thank you. Bye.